a Monday morning, and it is Health Monday with Jacob and Jared Johnson from Marble City Pharmacy. And what's on the shelf? You've seen these movies where they do sequels. This morning, we're on part 3 of What's on the Shelf. Good morning, gentlemen.
Good morning.
Good morning.
Good to have you with us this morning. Good to see all is well in the pharmacy world, and y'all are still helping folks, right?
Still running.
A lot of flu.
Oh, goodness.
A lot of flu.
It's been bad last few
Got a late
weeks.
start this
Flu
year.
season was over with.
You got a late start this year, but it's come on real strong.
Yeah.
Had a lot.
Yeah, well, we were talking this morning about what's on the shelf, pain relievers and fever reducers. That works right into what our topic is today.
Rolls right into it. Yeah,
Yeah.
a lot of that going on. A lot of questions we get asked.
Well, let's talk about it this morning. Some of the, pain relievers, and they're almost endless of what's on the shelf.
Well, I was trying to think about this morning. We have at least
It's hard for you to try to think about something.
8-foot section. Yeah, no joke. We have maybe a 12-foot section of pain relievers and fever reducers, and it dawned on me how difficult it might be to tell the difference. So why don't we just start with this? Just basically categories of what's out there. If we break them down into categories of what's out there, maybe we have a better understanding by the time we get done with this segment. So let's look at it like this. Of the oral medications, you have your acetaminophen, which goes by the brand name Tylenol, right? It's kind of in a category by itself. Then you have your non-steroidal anti-inflammatory drugs, or NSAIDs for short. This would be your ibuprofen, which is Advil or Motrin. It would be your naproxen, which goes by the brand name Aleve. It would be your aspirin and your methyl salicylate, which is in Doan's pills. Some people call those Doan's kidney pills.
That's
although
magnesium
it's not
salicylate.
what'd I say?
Methyl.
Yeah, it's not methyl salicylate. That's topical. I'll get to that in just a second. So those medicines are anti-inflammatory medicines work in a different way. For your topical medicines, you have camphor and menthol. Those are counter irritants. We can talk more about that in just a minute. You have methyl salicylate, which is kind of in a category by itself. And then you have capsaicin. So really you have 2 different categories of oral medications, even though there are 50 products on the shelf, and 3 different categories of topical pain medicines, even though there are 20 things on the shelf there.
So to help me this morning, let's just use the word Tylenol instead of that other word. You can explain that if you like, but how does all this work?
All right, so Tylenol is, in general, it's tough to make general statements on medicine, but let's make a general statement. One of the easiest and safest products to go to for the widest variety of patient or customer in this category. And so it works for a lot of folks. Oddly enough, it's been 50 years this year since we put a man on the moon, and there's not anybody in the world that can tell you exactly how Tylenol works. It's one of those, you look, mechanism of action, somewhat unknown. You love that, right?
You sure we went to the moon?
Well, since they landed in Nevada at night and said it was the moon, right? And so, Tylenol has been out there for years and years and years and decades. It works centrally. In other words, it does its primary action north of the neck, and basically affects how the body feels pain and translates pain. So, but it does most of its work here, which is where most of my medicines need to work. Is this general area right here, and so it affects the way our brain translates pain in the body, and that's how it helps reduce pain. Also has an anti-fever effect, lowers temperature when you have a fever. It's very safe for most categories of people. You can give it to babies on up to the elderly. You can take it when you're pregnant. Pretty much every category you got, with the exception of, if you've got extreme liver issues, I'm gonna get them mixed up somewhere. If you got liver issues, you don't need to take a Tylenol. That's your main, big no-no there. And your dose is affected by what age you are. So you do need to ask questions of your doctor pharmacist on dosage. Yeah. But in general, if you've got a fever or a pain, Tylenol in general is a very safe go-to.
Hey, Jared, I don't know if this can be any way psychological or not, but I see people that are just sick. I said, will you take some? I take a Tylenol. That's a general term. We take a Tylenol and try to go on.
It is, and for most people, like Jacob said, that's fine. There's another category of, I would say, go-to medicines, and that would be your anti-inflammatories. When we start thinking about the anti-inflammatories, again, your ibuprofen, which is Motrin or Advil, your naproxen, which is Aleve, your aspirin, and your magnesium salicylate, which is in Doan's backache pills. This category of medications is probably the next most widely used behind your Tylenol products. Well, first of all, they work a little bit differently. There is a sense in which these medications also work to block pain receptors in the brain, but they also work in the periphery to reduce inflammation. That's why we call them anti-inflammatory drugs. There are more restrictions on these medications. For example, we do not use them in patients who are pregnant. We do not use them in patients who have kidney problems. The older you get, the less quality kidney function that you have, the more these medications become a no-no. We don't use them in kids who are less than 6 months old. We don't use them in kids who have, or not kids, anybody who has some sort of stomach ulcer or internal bleeding problem, because they can have a little bit of a coagulant effect or a bleeding. And so if you're on a blood thinner, we also don't use those medications in that population. However, they are extremely effective for all kinds of pain. And when you have things like even in strep throat or even in the flu, these medicines can be very effective, not just for pain, but for reduction of fever as well.
We're talking this morning about pain relievers and fever reducers. What's on the shelf, part 3. And Jacob and Jared join us for a few more minutes this morning. And we've talked about Tylenol. We've talked about the anti-inflammatory medications. But there are others that we want to talk about this morning that is a lot of people watching this broadcast use and continue to use.
Yeah, tell you what, a good next one to talk about in the topicals might be out of order how we mentioned a minute ago. Jared just talked about anti-inflammatory drugs that we take as pills. We take orally. Well, let's move into topical medications, but for ease of discussion, let's move into the anti-inflammatory topical medications. He said certain people, stomach problems, bleeding problems, can't take these oral anti-inflammatories, can't take the Aleves, the Advils, the aspirins of the world. Well, there are anti-inflammatory medications that come in creams, ointments, gels, topical medications you can rub on if it's a specific joint or a specific area that hurts, that aren't going to have those system-wide effects of irritating your stomach or messing as much with your kidneys. They become safer at that point. And so those are, if you're flipping products over and looking at ingredients, you'll see methyl salicylate, 2 words there, methyl salicylate, or trolamine salicylate. You'll see that word salicylate. You see that, that's anti-inflammatory. And so there, Aspercreme has a version of that. Goodness, so, I think Bengay is mostly menthol. But anyway, you'll see, you have to flip the box over because all these products have different names and they're basically combinations of the same 2 to 3 ingredients. So you want to look and see what you're getting. But Aspercreme, I know, is trolamine salicylate. So you're looking at things that are anti-inflammatories there. Hey, my stomach is messed up, or I'm on blood thinners, or my kidneys aren't as good as I want them to be, but I've got inflammation in this joint here. Well, you can grab one of these products, rub it on, and that's a good candidate for you. And so those people know that there are anti-inflammatory drugs that you can take, just they need to be in a topical form, and you need to know where it hurts before you start.
Who uses these?
Well, that's a great question. And honestly, it's how to word this. Those north of a particular age, these are very good candidates for. Let's put it that way. Again, as we said, as you get on up there in years, and I will let every individual determine where they fall on that spectrum.
Being politically correct.
Yeah, these other drugs are significantly less safe for you. Let's just say 65 and over. These pills, your aspirin, your Advils, all those things, become less safe for you as your kidney function just naturally declines. Doesn't mean you're sick, it just means your kidney function goes down as you age. It's the way it is. So, again, you got an acre of pain in a joint, you can take these topicals, rub them on, not have all the side effects and dangers we worry about, but still get the good effects where it hurts. Great candidate.
Jerry?
Well, I'm glad you talked about those. There are 2 other types of medicine that are in topical analgesics. And what Jacob talked about, the Aspercremes and the methyl salicylate type products, Those are fantastic for joint pain, inflammation, and that sort of thing. You also have a category of medicines called counter irritants. You don't have to remember that word, but basically it's your menthol and your camphor. When you go to the shelf and you look at your Bengay or your Icy Hot and some of those type medications that are used for muscle type pain, they usually have some combination of camphor and or menthol. Sometimes they're even in combination with methyl salicylate, trying to do kind of the best of both worlds. But your counter irritants, menthol and camphor, they basically almost try to trick you into thinking that you're not in pain. They cause a certain type of sensation at the top of the skin to basically make you forget about what's happening below there. It's kind of like when you go to the doctor and you get a shot and your mom pinches you on the arm to try to take the attention away from what's happening there in your arm. But those medicines can be very effective for muscle pain. I personally used to use Bengay a lot in my younger days when I was an awful rec league pitcher and I would wear out my arm. But anyway, so you got those type of medicines available for muscle pain. There's another type of medication that has a much more narrow focus. It's called capsaicin. You may have heard of that. It's in a few products called capsaicin HP, or is it?
HP.
Yeah, it used to be, one of them used to be called Zotrix HP as well. I'm not even sure that one's on the market anymore, but you can find this medicine out there. Honestly, its main use is for nerve type pain, and probably the number one use would be for a person who has had a shingles rash. And without getting too technical about that, this medication kind of penetrates into the nerve endings. It kind of helps stop this particular substance that causes pretty severe nerve pain after the shingles. So for those of you who had a shingles rash, you've taken your antiviral medication and gotten rid of the rash, but you still have that nerve pain going on down there. There is an over-the-counter medicine that we can show you. It'll work for that.
And this is not on our information to talk about this morning, but shingles. Understand that there's inoculation shots that you can take to prevent shingles or treat shingles. How does that work?
Prevention.
Okay.
And it is, roughly a year ago this month is when a new vaccination was introduced onto the market for shingles. It's called Shingrix. It is a 2-shot series. You get your first shot, 2 to 6 months later, in a perfect world, you get your second shot. It's been extended up to a year. They say that second shot's fine, but 2 to 6 months is the ideal range. You get your second shot, and you're done. It's not an every 5 years and every 10 years. It's none of that. It's those 2 shots within the year, and you're done. And it is showing so far in studies to be well over 90% effective in preventing any future case of shingles. Yeah. And so much better than what we've had previously on the market. Good numbers so far. As time goes on, those numbers will get more accurate and honed in exactly what the number is. But it's been a very effective shot that we widely promote and say, hey, it's a good idea.
Oh yeah.
And we've talked about pain. I've been told, I've never had shingles, but I've been told that's some of the worst pain you could ever encounter.
It is, and one of the difficult things is, like I mentioned, once you get rid of the rash, sometimes the pain doesn't go away for weeks or even months. So it can be a pretty serious deal. The older shingles vaccine was only around 50% effective. And so it was better than nothing. Obviously, 50% is better than 0%. But this new vaccine is so effective that we're encouraging everybody over age 50 to get it. And it's been so popular that we've had a very difficult time keeping it in stock. We happen to have some right now, but to be honest with you, I don't know if we're going to have any 2 weeks from now, because there's been such a demand for it. Haven't been able to keep up with it so far.
What's on the shelf? Talking about pain relievers and fever reducers. A couple of more relievers and fever reducers I want to get to this morning. And Jacob, we'll leave it with you here for the next one.
Maybe a combination product.
I'm about to say, all we've left
I should have went with
all we've left is combinations.
I can't believe you can read my writing.
Well, I did. That's why I keep doing him.
This is the first time in 2 years he's been able to read your writing. I don't know what's happened to you.
All caps, baby. All caps.
That worked. Combinations of products we've talked about already. For instance, most everybody's familiar with the name Excedrin. Everybody's familiar with Excedrin products. And what Excedrin is combination of Tylenol and aspirin and caffeine. Works really well for headaches. Now, I will tell people, watch out on the labeling. You'll see Excedrin migraine, Excedrin tension headache, Excedrin this, Excedrin that. All the same product at the same strength. They just put different boxes on it. So don't think you need one of each for different types of headaches. But for headache medicine, a lot of general pains, that combination works wonders. But just know that there are combinations out there. There are combinations of pain relievers and fever reducers in sleep medicines. Tylenol PM, Advil PM, ends in a PM, chances are it's got that drug we've talked about already in it, and something like a Benadryl or some other antihistamine to make you fall asleep. I wouldn't recommend those every night of your life if you have a chronic sleep problem, but again, for the occasional sleep disturbance, those work well. And they have these pain relievers, fever reducers in them. So the same warnings we gave, don't take this if, apply to the sleep product with that name as well. Just know that. And it's not just a sleep medicine, it's also got these pain relievers in them. So if we said you can't take Advil, then hey, you can't take Advil PM either. It's got the same medicine in it. Just know that.
Most of these products are on the shelf at Marble City Pharmacy this morning.
Every single one. Finally, we get to the commercial part.
Yes.
Also, here's, we didn't say this, I hope this goes without saying, but if you're a patient who's in need of a pain reliever or a fever reducer, please, please, please talk to your pharmacist. Now, if you're a 30-year-old who doesn't have any health conditions and doesn't take any type of medication at all, okay, fine. You don't really need us. But for most of you who are watching this show, you have multiple medical conditions, you have multiple chronic medications that you take, and maybe you're old enough that your kidney function is starting to decline. So please, please, please ask us, what is it that's appropriate for me with my health conditions and with my medication?
And it can be dangerous combining all these things without knowing about what we're putting in our bodies.
Absolutely. And one major point on that is the misconception that, well, it's on the shelf and it's $5.
Yeah.
How potent can it be? How dangerous can it be? What can it possibly do to me? Right? People, it's cheap, and I've seen this product name for the last 50 years, and it's sitting right here, and it's over the counter, so it must be extremely safe. Exactly. And the answer is generally they are, but. And then there's ... There's so many things we need to talk about. So again, like he's saying, talk to us. It may not be the right product for you that you think it's cheap, readily available, it must be safe. It may be a terrible choice for you with your individual issues. So please talk to your pharmacist before you start using these things.
Let me give you a good quick example of that. There's a popular prescription medication used for headaches called Fioricet. Most people who take that may have no idea that it actually has Tylenol. It has acetaminophen in it. So if you're a person who has to have Fioricet, for example, for headaches, but then you go out to the shelf and buy Tylenol on top of that, you may be getting into a situation where you're getting too much Tylenol in your body, because there are daily limits for all of these medications. So I want to be sure that we're making sure you're not going over the limit.
Yeah, and I highly recommend Marble City Pharmacy. They're my pharmacists, and they do a fantastic job. And as we conclude this segment, What's on the Shelf, Pain Relievers and Fever Reducers this morning, you guys are very busy, but you're never too busy for a patient to say, hey, I got something I need to talk to you about.
That's right.
Absolutely. And I tell people, especially this time of year with the flu going crazy, if you come in and we're swamped and we say, yeah, give me a minute, I'll be out there, that does not mean I hope you'll go away. That means I will absolutely be out there to spend as much time with you, as you need. Let me finish what I'm working on, at the head, and we'll absolutely get to you. So don't shy away. Oh, there's 20 people in here. I don't want to ask them a question. No, that's perfectly fine. We have to wait a couple minutes, but please don't shy away from asking us a question just because we're busy.
Peak season, how many prescriptions do y'all fill a month?
A month?
Yeah.
Well, I don't know. A whole bunch. 12,000,
yeah.
13,000, yeah, somewhere in there. That's a lot.
Wow, it is. A lot of people need medication, know what you're taking. Talk with our friends Jacob and Jared at Marble City Pharmacy. It is Health Monday on this 11th day of February. Thanks, guys.
Thank you.
Thank you.
More Daybreak right after this.